Don't forget to click the subscribe button
and the notification bell
to see more of the Contessa's videos.
Hi everyone, I'm back again. My name is Joreen Bautista, and today what will be done to me is the non-surgical nose enhancement. So as you can see, my nose is a typical Filipino nose, nothing wrong with it, but a usual step I do on my makeup routine is I put a bit of contour on my nose, and what this procedure actually does, it enhances the nose in the way that it gives that nose line effect. And that's what I want to achieve. It's very natural, it's also temporary. So I'm really excited for the procedure and for the results. Don't forget to click the subscribe button below and the notification bell for more videos to get notified.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic on the improving the profile, the so-called nasofrontal angle. And let's welcome back Miss Joreen.
Hi everyone!
Yeah,
I'm back.
So, yay! So, before we did a so-called microdermal injections or the mycotoxin injections to improve the texture of the skin, to tighten the pores, to reduce the so-called sebum production, and we also did under eye filler, right?
Yeah.
Yeah, like a couple of months ago? Few months ago. Right. And looking at Joreen right now, skin texture-wise and under eye, still okay.
Yeah.
Right.
Still okay.
Yeah, considering she's just very young, 21 years old. Or she looks
Young.
like high school eh. No? She's so young looking. She's still a baby. Okay, so today our topic is to do an enhancement of the radix part of our nose. Okay, so actually a while ago, Joreen and I were talking about this angle of the nose, or this mathematical formula, or the rule of proportions, or the golden ratios, something like that. So we have these types of ratios and proportions that we follow when we do enhancement of the face. So it's not really like doing a procedure on the face, changing your looks, or it's not the so-called parang retoque, or yung mga treatments that will really address the anatomy, changing it already, or making you look at like a different person already. But this is something, just an enhancement of what you have, right? So if we assess the side view of Joreen, okay, so actually a while ago I was trying to do a measurement. If you make a vertical line from the forehead region towards the lowermost portion of the nose, and then a diagonal line from this lowermost portion to the tip of the nose, that's the so-called nasofrontal angle. Ideally, it should be within the 130 degrees to 135 degrees. Okay, and then actually there's still a variation between male and female, but generally speaking, we follow that 130 to 135 degrees. And I was assessing the angle for Joreen. It was like this. So we were like doing this a while ago. So like we have a right angle like that. So the vertical is a little bit tilted forward and the horizontal is downwards like that. And we were trying to make a measurement. It's somehow like 120 to 125. Okay. It's just like a rough estimate. But we wanted to somehow improve it, make the frontal part here straight like that somehow, and then make the lowermost portion still diagonal downward, something like that, to reach that ideal 130 to 135, right? So we just wanted to improve basically the radix region. And Joreen only wants a very natural result,
Yeah.
right? So something that will just make it that still Joreen, she's still Joreen, and that people will see her like there's something, but they cannot pinpoint what that something is. Okay? Tama ba, Joreen?
Yes, yes. Tama. Tama.
Kasi like, syempre, right now, we do online like classes, meetings, and of course, we don't want that like people will really notice there's totally something different. Is that Joreen? Yung something like that. So we still want something na when they look at Joreen, oh, Joreen, you're so fresh looking today. So something like that. Okay, because her parents also wouldn't want me to alter her looks, of course. Okay, and now so in terms of doing the radix improvement, so we'll just improve this radix. We will be approaching it, of course, in a very safe way. It's we're gonna use products that are very natural, something we find in our system, in our tissue, something that's very biocompatible. So what kind of treatment, what product material are we going to use? We'll show that when CSA Medical Aesthetics return. So we're back mga ka-CSA. So again, we will be doing the improvement of the radix part of the nose or the nasofrontal angle. Actually, I'm looking at the nasolabial angle. This one is okay. So we wanted like a 90 to 100 degrees here. So we'll just be working on the radix part. Okay. So as with any procedure, you have to clean the area, disinfect, and you can apply your topical numbing cream. And at the entry point, I'll still be injecting my lidocaine. So just at the tip of the nose, a tiny lidocaine here. And then since I'll be using a cannula for the injection of our hyaluronic dermal filler, okay, I'll make a puncture at the tip region. And I have a hyaluronic filler here. And I have a gauge 25 cannula and insert through that entry point and just pull the nose upward and glide. So I want to reach the radix part, just pressure, inhale, exhale, Joreen. Okay. So just some resistance there, a little bit. Because actually Asian nose, we're known for having this rounded nasal tip. And there are some thick tissues also at the tip region. So I'm nearing the radix now. So I'm using a cannula. So we wanted to stay midline and we wanted to also stay at the deepest layer, deepest anatomical layer. Okay, because we know that the vascular area is at the layer 2, layer 3. And then we can push our product material here. This is a hyaluronic. It's a natural substance. We find it in our system, in our body. So it's very safe. And we'll just be injecting a minimal amount only. Now our hyaluronic also has lidocaine. So I don't need to do multiple lidocaine injections. Now I have my polydioxanone thread. I still wanted to enhance the bridge of the nose. So I have here my cannula loaded with PDO thread. So towards our radix. So we have thick tissues on the nasal tip. So it's normal to feel some resistance there. And I just glide towards the radix. Up. So for Joreen, we'll just be using minimal number of threads. So some resistance, inhale, exhale, and then you have to really insert the entire length of the cannula. Make sure that there's no thread coming out from the tip. So second one. So some resistance on the nasal tip region, has thicker tissues. And inserting towards the radix. Okay, there you go. and pull out. And then this is our third PDO thread towards our radix again. Okay. So this is to enhance, improve our radix part, and also improve the nasofrontal angle for a better profile. So for Joreen, I'll be using only 5 PDO threads. So this is my last one. And then after this, we can actually check for balance or symmetry, left and right. Okay, so we'll just be pressing on the tip for a while. So we're done with our nose enhancement. We'll show the result to Joreen when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we'll now show the result to Joreen. I'm so excited actually. Just few of the threads, few of the hyaluronic filler, but there's a great impact. So let's show the mirror.
I'm so excited.
Yeah. Here's the mirror, Joreen. Okay, there you go.
Oh, wow.
Yeah, right? So
Yeah.
it's basically improving the radix part of the nose, the lowermost portion of our nose. So it's the superior bridge part. And we use dermal filler with the minimum amount only, and also 5 PDO threads only. And looking at the profile, the nasofrontal angle, so the ideal 130 degrees, we have that. Now we didn't do anything on the columella part, because if you look at her columella and labial angle, it's already the right angle. So the nasolabial or columella labial angle is in the right angle already, because there's already an elevation of the tip. It's more of the radix that's somehow inadequate. So we just filled in the radix part to balance it to the entire length of the nose. So the center of the face, one of the attractive areas of our face, right? So Joreen, let's hear your comment or your feedback.
I don't know, I'm so speechless.
Yeah.
I like it, especially sa side.
Yeah.
But I'm still,
Look at your eyes.
my eyes. Yeah, I don't know what's with my eyes. Something happened with my eyes.
Like the impact also on the eyes. So something like your eyes became more rejuvenated.
I think with the enhancement, it carries
Exactly.
over. Yeah.
Correct. See? Still natural, still Joreen. Actually, the filler and thread that we have inserted right now, over time, it will still blend in and integrate with the tissues inside. So it will still soften. You might see it somehow sharp looking a bit, but few days, a week or two, it will blend, so it will still become softer or smoother on the surface. Not so sharp looking, but actually I love it, right? So it's the nasofrontal angle that we have corrected or improved, okay? So it's just the right amount, so less dose only, right? So do you have any question, Joreen?
Was there anything I have to do with it or not do with it? Is there any do's and don'ts?
Yeah, so when we do nose injections, of course, expect some soft tissue swelling the following day. You can take analgesics, anti-inflammatory or anti-swelling, do ice compress. And then, of course, during the first few days, don't manipulate yet, okay? Don't sleep with your face on the bed. That's just a joke, okay? So, don't eat anything that's we call malansa, or avoid yung mga allergogenic type of food. So, no strenuous activities for just 2 to 3 days, or no heavy weight lifting. You're not into those naman, right?
Not heavy weightlifting.
Okay,
No, yeah.
so, but of course, the mild activities, mild to moderate, it's fine. Okay, so anything more, Joreen?
No, thank you.
I like your eyes. I'm looking at her eyes. Okay, parang pati yung eyes niya na-improve lalo. And even yung under eye niya. It's the thing when you project the bridge, the radix part, somehow the medial canthal eye, the skin there, if it's saggy, because there's a projection, it's pulling the skin under the eye also forward. So, rejuvenating your eye area. Okay, thank you so much, Joreen.
Thank you so much.
Yeah. So, this is just a procedure. It's actually a simple type of nose enhancement. We just use minimal doses. Less is more, as they say. And the thing is, the hyaluronic is there, so it will still give that volume on the nose, plus the threads will stimulate formation of fibrous tissue networks. Okay. And we've used materials, of course, they had scientific studies or they were clinically studied. So these are very safe. And also the technique that we use, we are following the right anatomical area, anatomical plane. So actually right now in my mind, I'm just like thinking of those social media advertisements that they post, for example, nose for only this amount. So very, very low price. Okay, do your research on what is the material or product that they're using, where did they get it, or also the injector. You have to do your research on the injector. Make sure that a licensed physician or like a physician who underwent trainings with aesthetics, or they really had done this for a long period of time. So it's not just a procedure that we've learned like few days only, 1 day workshop, 2 or 3 day workshop, that you know everything already. Plus we vary in our anatomy. Not everybody has the same kind of size and shape. So I always say it's not like one shoe fits all.
Yeah.
It's not something like that. So for every individual, we still have to do a so-called assessment. And so in terms of how much we price it really varies, it depends. Like for Joreen, we only use a minimal amount, and we just wanted to balance everything, and we still want Joreen to be Joreen. Okay, so I'm pretty sure it's still Joreen. But up to now, I'm kind of starstruck. Kasi ang ating young lady here, beautiful to more beautiful. Glory to God. Thank you so much.
Yes. Thank you.
Right?
Thank you so much.
Yeah. And looking at Joreen, actually I was also doing an assessment on the nasal tip region. What I would recommend to Joreen will be like a so-called nose mesotherapy. It's injecting a fat dissolving solution to somehow reduce those fatty tissues at the nasal tip. And also for the alar region, we somehow wanted to just minimize it just a little bit. Okay, so it's already within the right dimension. Okay, if you look at the intercanthal width also, it's just okay. We just wanted to lessen it a bit. And looking at the so-called rickets line, next time I would recommend to Joreen, somehow just balance the chin projection also for the rickets line. Ayan! Parang may project na naman kami, Joreen. Parang as time passes by, the more I see some things and then we improve. But of course, it's just within the right ratios and proportions. Okay? So Joreen, thank you so much.
Thank you. Thank you so much. Thank you,
Yeah. If they have any questions, like, can they ask
They
you?
can DM me on Instagram
Yeah.
or tweet me on Twitter.
Right.
Yeah.
Because they might ask you like, masakit ba, Joreen?
Yes. Yeah.
Yun ang tinatanong nila.
You may also email your questions.
Right.
JoreenBautista@gmail.com.
Yeah, and you may email me also at csaskinclinic@yahoo.com. DM us at our FB page, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. So when it comes to natural beauty, you can trust the CSA Medical Aesthetics.